This is Vicki Ribsam, Joint Replacement Nurse Navigator, and this is our comfort module. So how much pain will I have after surgery? Everyone has a different experience of pain. Pain can be different from episode to episode. It's also different from joint to joint. There's many times where we've cared for patients who are having their second joint replacement and are having more or less pain than their first and asking, why is it different? And that is really because each experience is unique. There are a lot of strategies that we're going to talk about that can help you manage the pain. When you're in pain after surgery, if you have pain, think about using some of these strategies. Know that you are in charge of your pain and you can manage your pain. Some pain is normal, but it should not prevent you from completing your activity, rest, and exercise. So you should be able to stick to your activity plan and your rest plan without struggling with pain. So what kinds of medication will I use? I usually like to tell people right off the bat that medication is very useful for pain, but activity, rest, exercise, elevation, and ice are really the keys to success with pain management. So although you will be taking some medication, really also focus on the other things that you can do to control your pain. There's other ways to control pain that we'll talk about, including meditation, reading, listening to music, relaxing, deep breathing exercises. So medication that we use, Tylenol, which is also acetaminophen, is fine to use if you do not have liver disease. Typical doses for that are 2 extra strength Tylenol, which are 500 milligrams each in the morning, 2 in the afternoon, and then 2 at bedtime. Tylenol works better if you take it around the clock for a few days, so we do encourage people to stay on the Tylenol for at least 2 weeks after surgery. Sometimes people take nonsteroidal anti-inflammatories. Examples of those might be meloxicam or Celebrex. If you do not have kidney disease, they are very safe to take. Sometimes we do not use them if you are taking prescribed anticoagulants, not including aspirin. Nonsteroidal anti-inflammatories are typically taken at lunch so that they don't coincide with the aspirin doses that you'll be on to prevent blood clots from forming. People who take nonsteroidal anti-inflammatories at the same time as they take their aspirin may have a higher risk of having stomach issues. Nerve pain medication like Lyrica or gabapentin can also be useful. Typically, those are prescribed at night because they can make you feel sleepy. They are low doses of those drugs, typically prescribed for 2 weeks, and they will help with pain that you might feel, including like burning sensations or itching or electrical type pain. We do typically prescribe opioids. We use limited doses of them, so pretty low doses. The typical opioids that people take after surgery are oxycodone or tramadol. They're usually prescribed 1 or 2 every 4 to 6 hours if you need them for pain. Like I said earlier, it's important to rely on other ways to control pain. Opioids have a lot of side effects. It can include constipation, nausea, stomach upset, itching, sleeping, not sleeping enough. There's a lot of different complications that can come along with that, and they are habit forming. So they are definitely used only if you need them. So if you need them, you need to take them, and they would be needed if you are having trouble completing your exercising, walking, resting, icing routine. Aspirin is typically used in the morning and at night at 81 milligrams to prevent blood clots from forming, but it also has an additive property of helping with pain. Swelling can cause increased pain, and it can also cause tissue damage and blood clots, so it is very important to manage your swelling after surgery. It is very common to have increased swelling at the end of the day. It's normal to wake up and the swelling is better, and then it kind of gets worse as the day goes on. It's also normal to have increased swelling towards the end or end of the first week, beginning of the second week after surgery. And that's really the inflammation process just working. The best way to manage swelling is with elevation. Elevation lets the fluid that's accumulated in your leg go back into your body. So the more you swell, the more you elevate. Ice is helpful for swelling around the incision. Swelling and pain at the incision is very responsive to cold therapy. Rest is also helpful. So you might find that a lot of activity aggravates swelling. Although activity and exercise are very important and critical to the outcome, rest is necessary in between those activities. And activity, some people need the activity to keep the swelling down. So balancing rest, ice, elevation, and activity is the key to managing swelling. Can stress reduction techniques help with pain? Absolutely. One of the most important things you will learn after surgery is sometimes the pain is best managed with breathing techniques, long, slow, deep breaths, guided imagery, music, novels, movies, TV shows, self-talk. Are you talking to yourself about your pain? Are you getting to know what makes it better, what makes it worse? Aromatherapy is helpful. Peppermint, cinnamon, ginger, lavender, these are all things that are helpful for pain. And mindfulness meditation. If you have any questions about any of the things that you might need to do to help control your pain, please call me, Vicki Ribsam, Nurse Navigator, Concord Orthopaedics.